You know, you walk into a clinic with a deeply personal, incredibly frustrating issue, right?
Yeah.
Like a total loss of physical sensation in your most intimate areas. And instead of writing a prescription for, I don't know, a daily pill or scheduling some complex invasive surgery, the doctor just draws a little bit of blood from your arm.
Yeah, just a standard blood draw.
Right. And they put it in a spinner and they tell you that your own plasma is going to regenerate your deadened nerves. I mean, it sounds like pure science fiction.
Boy, it totally sounds like magic.
Hmm.
But it's actually happening in clinics globally right now.
Yeah.
Today's deep dive is tackling a highly specific, undeniably controversial, and really rapidly growing regenerative therapy that's marketed for female sexual wellness. It's called the O-shot.
The O shot. And the mission we are totally obsessed with today, the core question we really want to answer for you is this. Can this shot actually help repair damaged nerves? Because we've got a massive stack of sources on the table to figure this out. We're pulling from peer-reviewed medical journals on peripheral nerve regeneration, clinical reviews on platelet-rich plasma in gynecology, practical FAQs from women's health clinics.
And, a really fascinating piece from The Guardian detailing the, let's say, rather unconventional origins of the procedure.
Yes.
We're going to bypass all the marketing gloss today and take you straight down into the microscopic biology of tissue regeneration, because we're looking at how your body's own blood might actually hold the biological blueprint for repairing some of our most sensitive, complex, and vital nerve pathways.
Okay, but before we get to the microscopic biology, we really have to talk about how this even became a thing.
Right, the history.
Yeah, because the jump from standard medicine to, injecting blood into the pelvis is just wild.
It is a leap.
The Guardian article traces this back to a physician named Dr. Charles Runels. He's the doctor who actually trademarked the procedure. And the story goes that he applied this concentrated blood serum, which we'll define in a second, to the clitoris and the vaginal ceiling of a patient.
Right.
And by the next afternoon, she reported immediate, intense ejaculatory orgasms.
Yeah, and he patented the specific application shortly after that. But the biological substance he was using wasn't actually new.
Okay.
He was using PRP, or platelet-rich plasma. And this is an autologous biologic therapy.
Autologous meaning?
Meaning it comes from your own body,
Mm.
making it fundamentally different from, like, a synthetic drug. You draw a small amount of blood, put it in a centrifuge, and just spin it down.
Okay, let's unpack this. So the spinning uses centrifugal force to separate the heavier red and white blood cells from the lighter plasma and the platelets, right? Leaving you with this highly concentrated sort of golden serum. But wait, drawing blood and spinning it sounds way too simple to cause actual biological engineering at a cellular level. I mean, how do we know this isn't just a trendy, really expensive vampire facial for the pelvis?
Well, the simplicity of the preparation totally masks the staggering complexity of what's actually inside that golden fluid.
Oh, really?
Yeah. This technology actually leaped over from sports medicine. Orthopedic surgeons were using PRP to cut healing times for elite athletes.
Wow.
Like, joint surgeries that usually took 6 to 8 months to heal were suddenly taking 6 to 8 weeks.
That's a massive difference.
It's huge, because when we concentrate those platelets, we're gathering millions of what are called alpha granules.
Alpha granules.
Right. And when those granules are activated sometimes by adding a compound like calcium chloride, they actually break open and release a highly potent cocktail of growth factors.
Okay, so if I'm picturing this right, say you get a normal cut on your finger. Your standard blood circulation is basically like the local police driving by a minor accident.
Okay, I like this.
They'll slowly redirect traffic, eventually patch things up, clear the road. But spinning the blood down into PRP is essentially concentrating an elite team of biological first responders and airdropping them directly onto a massive emergency to do like months of work in a fraction of the time.
That is exactly it. The platelets are the first responders, and they bring an incredibly specific toolkit to that emergency. You have growth factors with these alphabet soup names like VEGF, PDGF, and TGF-beta.
Right.
PDGF, or platelet-derived growth factor, triggers rapid cell division. VEGF is vascular endothelial growth factor, and its job is angiogenesis,
Which means...
literally signaling the tissue to build brand new blood vessels from scratch.
Okay, and TGF-beta, what's its role in this whole cocktail?
So that promotes the deposition of the extracellular matrix, which is basically the physical structural support system for your tissues.
Oh, wow.
Yeah, so injecting PRP doesn't just mask a symptom with a chemical painkiller. It biologically signals the tissue to build new blood vessels, generate new cells, and physically restructure itself from the inside out.
That's incredible. But if PRP is this highly targeted delivery system for all these regenerative building blocks, how does that actually interact with a damaged nerve? Because nerves are notoriously finicky, right? It's not like healing a simple muscle tear.
Not at all. To understand the repair, we really have to look at the damage first.
Okay.
The clinical term is peripheral nerve injury, or PNI. A peripheral nerve, meaning any nerve outside your brain and spinal cord, can be damaged by direct physical trauma, metabolic disorders like diabetes, or even just as an unintended side effect of a surgical procedure.
And a severed or crushed nerve doesn't just sit there waiting to be fixed. There's an entire biological cascade that happens immediately. The sources talk a lot about Wallerian degeneration.
Yes, Wallerian degeneration is essentially the nerve cleaning house.
Okay.
When an axon, that's that long wire-like part of the nerve that actually transmits the electrical signals, is severed or crushed, the segment of the nerve distal to the injury, meaning the part farthest from the brain, actually breaks down and dies.
Oh.
Yeah, the myelin sheath, which is the fatty insulation protecting it, totally degrades. It sounds catastrophic, but it's actually a necessary clearing of the cellular debris so regeneration can eventually occur.
It almost feels like a collapsed highway. Like if a major bridge falls down, you can't just build a new bridge on top of the rubble.
Exactly.
You have to send in crews to clear away the broken concrete first. And in the nervous system, those cleanup and construction crews are these things called Schwann cells.
Schwann cells are totally the unsung heroes of the peripheral nervous system. After they clean up the cellular debris from that collapsed highway, they proliferate and line up to form something called the bands of Bungner.
The bands of Bungner.
Right. Think of these bands as microscopic biological tunnels. They provide a physical, structural guide track for the surviving nerve stump to slowly sprout a new axon and, find its way back to the target tissue.
But those Schwann cells move incredibly slowly, right? Which is why severe nerve damage takes forever to heal, or sometimes just never does. So bringing PRP into this specific damaged environment, that's like taking our highway repair crew and suddenly airdropping a massive supply of raw building materials like steel, concrete, oxygen, and hiring 1,000 extra workers to speed up the job.
If we connect this to the bigger picture, PRP provides what clinical researchers call neurotrophic support.
Okay.
The concentrated growth factors in the plasma actually mimic your body's natural nerve growth factors. This artificially stimulates those vital Schwann cells to multiply far faster than they normally would.
Wow.
And at the same time, the VEGF we mentioned earlier is triggering that angiogenesis,
Right.
building new blood vessels to rush oxygen and nutrients to the starving, damaged nerve tissue.
I also read there's a structural element too, right? Like the PRP isn't just dump chemicals and leave.
Right, right. When activated, PRP lays down a fibrin matrix.
Fibrin matrix.
Yeah, it creates a soft biological scaffold. It actively shifts the local environment from a destructive inflammatory state, where the body is just attacking the damage, into a reparative inflammatory state.
Oh, that makes sense.
Yeah, and the new nerve cells literally use this fibrin matrix to crawl along and rebuild the tissue architecture.
Okay, so the biology tracks beautifully on paper. The first responders lay down a scaffold, they build blood vessels, and stimulate the Schwann cells to rebuild the highway. But does this actually translate to a living, breathing nervous system?
The preclinical animal studies provide some incredibly compelling evidence here. One specific study in our sources looked at 45 male Wistar rats.
Okay.
Researchers deliberately severed the sciatic nerves in their legs to test this exact mechanism.
Wait, severing the sciatic nerve, that's huge. I mean, severing, it means complete loss of motor function in that limb. The rat essentially just drags its leg.
Yes, exactly. It's a major injury. So they divided the rats into groups. For the experimental group, they surgically bridged the severed nerve using a tiny silicone tube or a conduit.
Right.
And inside that tube, they placed just 20 microliters of PRP.
20 microliters, I mean, that's practically a microscopic drop.
It is a fraction of a single drop. They observed the rats for 12 weeks, and the rats treated with that tiny amount of PRP showed significantly accelerated functional recovery compared to the control group.
Wow.
They had better nerve signal conduction and, crucially, improved muscle mass in their legs.
Oh, because the nerve regenerated fast enough to stop the muscle from dying.
Exactly. The signals were firing strong enough to stop the muscle from completely atrophying.
Mm.
And histological analysis looking at the tissue under a microscope showed thicker myelin sheaths and much more organized nerve fibers.
Look, curing a rat's severed sciatic nerve is genuinely amazing. But we've got to bridge a massive gap here. Human nervous systems are vastly more complex, and let's be real, human sexual function is exponentially more complicated than a rodent's leg muscle.
Oh, absolutely.
So how do we know a drop of plasma in a rat's leg translates to human pelvic nerves?
Well, human clinical data for nerves is still evolving, for sure.
Yeah.
But we do have direct human applications showing PRP works on our nervous system, too.
Like what?
Early clinical trials are using PRP injections for conditions like carpal tunnel syndrome, where the median nerve in the wrist is compressed and damaged. They're using it for ulnar neuropathy. There are even very early experimental applications injecting it into spinal cord injuries.
And those are showing real, measurable results.
They really are. They're showing improved nerve conduction velocity and reduced pain. Now, the human data lacks massive, decades-long randomized controlled trials, and the protocols vary, like some clinics spin the blood for 5 minutes, some for 10.
Right.
But the foundational mechanism remains identical. Whether it's a rat's leg, a human wrist, or human pelvic tissue, the biological process of stimulating blood flow, laying down a fibrin matrix and activating Schwann cells to repair axons, that is a universal biological language.
Okay, so we take these proven nerve-regenerating principles of platelet-rich plasma and apply them directly to female sexual dysfunction. But if you're listening to this right now, hearing the words needle and clitoris in the same sentence probably sounds terrifying.
It does sound intense.
How does this procedure actually work, and how painful is it?
Surprisingly, the procedure is remarkably straightforward and fast. Clinicians apply a very strong topical numbing cream first.
Okay, thank goodness.
Right. Once the area is completely anesthetized, they take about 5 cc of the prepared PRP, which is roughly a teaspoon of fluid, and inject it directly into 2 specific areas.
Which are?
The first is the clitoral corpus cavernosum, the erectile tissue of the clitoris. The second is the anterior vaginal wall in the periurethral area, often referred to as the O spot.
And because of that numbing cream, the sources say the pain is really minimal, usually described as just a feeling of fullness or a slight pinch.
Exactly.
But the moment that fluid is in, those growth factors go to work on very specific kinds of pelvic nerve damage, right?
Yes. They target tissue suffering from atrophy, loss of elasticity, and reduced sensitivity. And this kind of damage is incredibly common. It can be caused by the trauma of childbirth, the natural aging process, or the severe drop in estrogen that happens during menopause. Menopause in particular starves these tissues of blood flow, leading to thinning, fragile tissue and damaged, unresponsive nerve endings.
And the clinics are using this to treat conditions like lichen sclerosus too, which is an autoimmune condition causing severe itching and scarring.
Right.
They're treating dyspareunia, which is the medical term for painful sex. The PRP is regenerating the underlying nerve and vascular structures to bring feeling and physical comfort back.
And there's also a significant secondary benefit that's really important.
Oh, what's that?
Because the PRP is injected near the urethra and the base of the bladder, the regeneration of tissue and the strengthening of the local sphincter muscles often leads to a drastic decrease in stress urinary incontinence.
Oh, wow.
Yeah, women who used to leak urine when they sneezed or exercised find that the regenerated, thicker tissue provides far better support and bladder control.
Okay, here's where it gets really interesting, though. I was reading through the clinical literature and our sources, and I found this bizarre biological paradox.
Oh, wait.
If PRP is really this incredibly effective at waking up nerves, repairing the myelin, boosting blood flow, is it possible it works almost too well?
This raises an important question. You're referring to the reports of hyperarousal.
Yes. The clinical studies document these rare side effects where women experience spontaneous orgasm or like a continuous extreme state of physical hyperarousal.
Yeah.
The nerve stimulation and the sudden rush of new blood vessels basically created an environment where the nervous system was just constantly, relentlessly firing off arousal signals.
So while an extreme state of hyperarousal is a very rare side effect, It acts as an incredibly powerful clinical proof of concept.
Oh, how so?
It proves undeniably that the biological signaling from the PRP is actively and profoundly altering nerve sensitivity and vascular response. This isn't just some placebo effect. The tissue is physically, demonstrably changing.
Right. Obviously, the goal isn't to have patients walking around in a permanent state of overstimulation. I mean, that sounds exhausting and completely counterproductive to daily life.
Exactly. The goal of all regenerative medicine is homeostasis. We're trying to restore a healthy baseline of pleasure, comfort, and normal function. The body naturally regulates these newly formed blood vessels and nerves over time, which is why those rare hyperarousal side effects resolve themselves.
Okay, that's good.
But it shows just how potent deploying your own concentrated growth factors can be on a cellular level.
Yeah, the biology tracks, the animal models prove the concept, and the human applications are expanding. But we really need to do a reality check here.
Yes, we do.
We have to look at the limitations because if you're looking into this, it's vital to understand why this isn't a guaranteed silver bullet for everyone.
First off, from a regulatory standpoint, the O shot is still considered off-label and investigational.
Right.
It isn't formally FDA approved or NICE recommended for these specific gynecological uses yet.
And the main reason for that is the lack of large-scale, long-term randomized controlled trials, right? The medical establishment wants to see thousands of women studied over 5 or 10 years with incredibly strict controls before they officially sanction it in the guidelines.
Exactly. Now, the individual components drawing blood, the centrifuges, the PRP itself, those are all FDA cleared. But injecting it specifically for female sexual dysfunction is an off-label application of an autologous blood product.
Got it.
But beyond the regulatory status, we really have to look at the immense complexity of the conditions women are trying to treat.
Especially when we talk about anorgasmia. The sources from the women's health clinics are very blunt about this. Never having had an orgasm is rarely just a localized tissue or nerve issue.
It's so much more than that. The female orgasm system involves a deep, intricate integration of the brain-body connection.
Right.
If a woman is seeking the O shot because she has never climaxed, a responsible clinician has to look at the entire picture. Are there medications involved? Many SSRI antidepressants, for example, heavily blunt sexual response at the neurotransmitter level.
Yeah, that's huge.
Is there severe pelvic floor tension? What is the psychological safety of the patient's environment?
So if I'm thinking about this, like a computer treating a complex issue like lifelong anorgasmia with just a needle is basically like trying to fix a software glitch by exclusively upgrading the hardware.
That analogy holds up perfectly in the clinical setting.
Like you can go in and use PRP to upgrade the hardware. You can build new blood vessels. You repair the damaged nerves. You make the tissue thicker and healthier. The physical hardware is now running flawlessly.
Right.
But if the software, the psychological environment, the hormonal balance, the chemical side effects of a daily antidepressant, if that software isn't addressed, the system as a whole still isn't going to boot up.
The clinical experts in our sources stress this constantly. The O shot shouldn't be sold as a standalone miracle cure. It has to be part of a holistic, multidisciplinary approach. A proper clinical assessment is absolutely vital before anyone even touches a centrifuge or a needle.
Because they need to rule out active infections, severe undiagnosed medical conditions, or deep-seated psychosexual trauma. I mean, if sex is painful because of a psychological trauma response that's causing involuntary muscle spasms, regenerating a nerve isn't going to fix the spasm.
Exactly. Regenerative medicine is a powerful paradigm-shifting tool, but it's just one tool in the medical toolkit. It addresses the physical, physiological decay of tissues and nerves, but it can't overwrite the nervous system's emotional memory, and it can't magically counter the chemical blockade of an antidepressant.
So what does this all mean for you listening right now? Let's just briefly recap the journey we've taken through these sources. We started with a very specific mission. Can the O shot actually help repair damaged nerves? And the answer we found in the cellular science is a resounding yes. It absolutely has the biological foundation to do so. By utilizing the incredible regenerative power of your own platelets, it releases growth factors like VEGF and PDGF. It stimulates Schwann cells to rebuild biological highways, and it lays down a fibrin matrix that brings blood flow and physical sensation back to damaged or atrophied tissues.
Yeah, and whether you're looking into the specific procedure for sexual wellness, or maybe you're recovering from a sports injury and considering PRP for a torn tendon, or you're just fascinated by the frontiers of biohacking, This deep dive really proves a fundamental shift in how we view healing.
It really does.
The future of medicine might not always be about finding the next great synthetic drug in a pharmaceutical lab. It might simply be about learning how to better isolate, concentrate, and deploy the miraculous healing tools that are already flowing right now through your own veins.
It's incredible to think that the cure for some of our most frustrating physical ailments is literally inside us, just waiting for the right signal. Which leaves me with one final lingering question for you to ponder.
Mm.
If we're already successfully isolating the signals in our own blood to rebuild severed nerves in rats, to heal athletes' joints in weeks instead of months, and to reverse tissue aging and restore sensation in our most intimate areas, what other permanent physical decline or nerve damage are we just a few centrifuge spins away from curing?